This is Rachel Galvin with Observer TV. I am here at the E. Pat Larkin Center for the Broward Health Public Forum on the North Broward Health District is considering leasing its public health system to a nonprofit group. They're hoping to avoid higher debt payments by structuring the deal to meet the federal law and also to satisfy the financial institutions and the individuals that lent them money. Some feel that this deal will not work and will indeed cost more money. We're going to take a look inside at the forum and see what the commissioners and the board from the district have to say.
So what got us started on the idea of transitioning to a 501c3 corporation? Well, some of the challenges that we have boundaries, we're constrained by charter by the Griffin Road in the south and the county line to the north. Our limited business partnership opportunities, loss of revenue and market share, and the unknowns essentially amount to the fact that if people finally become insured, are they going to continue to use our system? So we're challenged by that. So we're in a scenario where our competitors have no limitations. They can, to raise capital, they can sell shares of stock. HCA is a private company right now. They're going to go public again. They'll have a public offering. They'll raise investment money. They'll be a formidable competitor, as they always have been since 1970. So our plan, essentially, was to simply make sure that we're all operating on a level playing field, that we can do all of the things that they can do, and to remove the barriers that we otherwise have in our operating model. Allow us to compete in the for-profit sector, allow us to, by that I mean partnering, joint venturing with private for-profit companies, on some business opportunities, expand our boundaries into southern Palm Beach County, where there's a lucrative Medicare market. So the notion of creating a 501c3 corporation was simply to remove the barriers under which we operate. Right now, we are studying the process. The board essentially revised its motion on Wednesday to authorize me to study this. It's taking several months to collect actuarial data on malpractice and actuarial data on pensions, things that people are worried about, which I'm sure if anybody has signed up for comments, I know there's going to be some questions about how the board gets selected, about whether we're going to continue the same operations, and we'll address those questions as they come up. I think we've had some meetings with some community folks today to try to address some of those questions. We don't have answers for all of them right now, but we'll take whatever the questions are and try to get answers, make sure we get answers for them. We'll have to answer those questions before we ever get to a transition, if it gets to that. And so, essentially, to sum it up, and then we have a few more slides on how we're legally able to do this, but to sum it up, we're talking about taking the same kind of model that we've had in place for the last 4 or 5 years, which is to continue to lower property taxes, continue to continue to increase our compensated patient base, and continue to drive revenues and profits into the system from the insured community. And that's the theme that we adopted based on what was in those earlier slides, to continue to go forward and to create a better healthcare system for the community, to create jobs. We've added 400 jobs in the last 4 or 5 years as we've grown the system by expanding programs, by expanding sites, a bigger ER. When we added the ER at Imperial Point, I think we added about 20 FTEs there, so we've created jobs over the last few years. So the point to some of this theory is that the North Broward Hospital District, as it currently stands today, has been a very aggressive business player in the community. We've created jobs, we've lowered taxes, we've put money back into the community through construction projects. and so forth. And the notion to move into a more competitive environment is just to continue down that path and make a better system for the county. With that, somebody's talking about Florida statute 155. And then I guess there'll be questions that'll come later on, or some comments from you.
Jim, I have a couple of gentlemen that want to come up and speak as a group, Mr. Vince Johnson and Reverend Sanders, along with Mr. Vince A. Thrower. All right. So you're all deferring your time? Okay. So you must be Mr. Vince Johnson.
Yes,
Hi,
I am.
how are you?
Yes, thank you. Good evening, Board of Commissioners, State Representative Gwendolyn Clark Reed, Commissioner Portier, former Commissioner Phillips, and Broward County Chair Levi Williams for all coming. One of the questions from the body is, and it's a two-part question, is anybody going to be refused care? That's the first part. And what is the guarantee that people will not be refused care in the future?
Well, it's essentially against the law to refuse care to people as a not-for-profit, so the answer is no. No one will be refused care. No one will be refused care for their inability to pay. It's actually illegal for not-for-profits or even for-profits to refuse care to patients. I mean, you can't. Yeah.
Okay, that was a question from the floor. Mine is really just a comment from just a group of individuals here in Pompano that just really got together really loosely. I really commend the board of the North Broward Hospital District, now known as Broward Health, for your outreach into the community, as well as Frank Nash and his vision for the future. We've known within this community that we want better care. We know that we're in the middle of a paradigm or a shift whereby we're on a teeter-tottering balancing act when it comes to taking care of the uninsured. And we know it's a monumental task. But I think what you've done tonight, what Frank continues to do to reach out to this community, is something I haven't seen in the last 15 years from this organization. And for you to just really get down to the grassroots of this community and really explain it to us in an elementary fashion really speaks volume for the new direction that this particular organization is taking. And it's a breath of fresh air, and we truly appreciate it. Thank you.
Thank you. How are you, Commissioner?
Oh, I'm fine.
Nice to see you.
Same here. Once again, Gwen, kudos for putting this on. I have a question for the board. Could you explain that DSH Medicaid and the DSH Medicare? What exactly is that? And is that something that we're going to be losing?
Yes.
Okay.
The DSH stands for disproportionate share, and there are methodologies based on, there's a calculation for facilities to use, and it's a calculation of their Medicaid days and self-pay uninsured days that goes into a formula, and you can get from 0% to, I think it's up to like 16 or 18% add on to your Medicare rate or your Medicaid rate for hospitals that have a disproportionate share of uncompensated care.
Okay.
So we do have a disproportionate share of uncompensated. If you remember the slides, we have 80%
right
in the northern part and 55% almost for the entire county. Those funds are earmarked to go into a pot, if you will, to fund health care reform. So they'll go into a pot one way and come out another way, and we don't know how they're going to come out on the other end in terms of how much we'll get paid.
Now this says unaudited 2010. In 2009, what were the numbers on that Medicaid and Medicare? You know?
They're probably about the same. It's probably about the two numbers combined are probably $50 or $60 million a year.
Okay.
Yeah. Off the top of my head.
Oh, okay.
I'm sorry, say it again.
In the long and short, that takes the 50 or 60 million that's being forced to leave the district to go back to
Correct.
federal government.
Correct.
Okay.
So now, if you're like, let's say, if you're in in our part of the county, we have 80% of the income. So if you're in the 20%, right, in the northern part of Broward County, and you lose your disproportionate share payments, if you get any, you're not really losing anything. And then as people go to your facilities, they may wind up, you may get, money back for that. So really, it's very little impact. For us, it's $60 million that will go out. And if it comes back through insurance companies, it may not come back in 100 cents on the dollar because insurance companies have some, profit margin built into their insurance plans. So we don't know how that's going to flow. It's that methodology. Like, for instance, now we're in this DRG mode. We know what the methodology is. You have a DRG, you get paid times, a rate times a weight. We don't know how that money, we don't know what the methodology is under healthcare reform yet. It hasn't been developed.
Okay. I do want to say, though, like everybody else has said, thanks again for bringing this to the community. I think this is very, very good. I'm just sorry that we didn't have more people here to be a part of this, to listen. But I do understand we are going to have some more meetings.
We have one next Monday.
Okay.
Yeah, I would say two things. One, it's a great opportunity, aside from the transition, for you to understand how we've been stewards of the county's money over the last 10 years. Because, some of the discussions I've had with some folks is when we talk about, transparency and so forth, but no one really comes to the meetings to know what's happened to the tax dollars over the last 10 years. So it's a good opportunity for us to explain that whether we ever make a transition or not, at least we're watching the taxpayer dollar and the millage rate and the property values, and we've increased our service level. So it's a great opportunity for us to convey that to members of the community. And if at some point we get to do the transition, then we'll, be...
Well, believe it now, because of the economic conditions, the community is watching.
Okay.
And the city, they're watching the cities too.
Okay.
Good evening to all of you, and thanks very much for holding this meeting. Oftentimes, folks make promises to the community that they're going to come in the community and hold meetings, and we don't ever see them. But I'm very happy that you kept your promise and you came to the community to hold this meeting. A lot of information that you've shared with us tonight has not really gotten to the depth of the resolution that you passed to do the study of the not-for-profit, of forming the not-for-profit. And I just wanted to know how far have you gotten along with the study, and how long is it going to be before we really understand what the study finds, what the finding of the study, what is the timeline?
The original resolution that you might be speaking about?
No, I'm speaking of
one we just did on
the one
Wednesday.
that was just done.
On Wednesday. Okay, well, I know that Frank is working on finding a consultant. We're working with an actuary. Frank, why don't you just tell me where you are instead of me trying to dig it out of your head?
Can I answer that?
Yes, you may.
I think we just released some information on the bonds, so we got that answer. One of the things that's taken a little bit longer is the malpractice actuary. It's a huge study, and pension, those pieces of information. And I think one of the other things that we're going to need is in December, when the regulations for healthcare reform are due out, we'll have to evaluate our revenue stream from those and what happens to our revenue. So we're probably a good 3 months away from getting that stuff in a package that we could say make sense out of what our revenues and expenses will look like.
Okay. We've been talking about, hearing you talking about forming this not-for-profit corporation, and how are we moving along with that? Have there anything been decided as to what's going to happen with that corporation?
Let me dispel the notion that was out there that I get to pick the people and pick my bosses, which is not the case. What has to happen at some point is that, and I don't know when, and I don't know when that happens, because I guess people in the community have to feel comfortable about it. But We need to find at least 3 to 5 community leaders that will come forward with articles of incorporation that this board has to approve. At this point, there probably isn't enough information for anyone to come forward on that. So that's probably fallen out into the same time frame. I think folks in the community are going to want to know whether we're going to be able to advance this project or not, would be my guess.
Yeah, and yes, that's true. And based on the who's going to be picking the people for the board, and just actually what are the criteria for being a board member, and also we're still in this little area about the sunshine law.
Right.
This board, will they be receiving the tax dollars that are being collected? And as I have often said to you, there is always going to be folks who do not have insurance. We know that healthcare reform, says yes, everybody will have insurance and da-da-da-da-da.
Right.
But we know that there will be people who will not be able to have insurance, and those people will still need to be served. So based on that, do we still collect the tax dollars from the public? Those are issues, things that really have to be spelled out, because when you say that everybody will have insurance and then you don't go any further with it, it makes it seem that, well, you guys are going to be getting tax dollars. What are you going to be doing with them? People have to understand that there's still going to be that population that needs to be serviced. And that's something that really has to be explained in your bylaws or what, that you promulgate.
Well, again, there's a couple of, let me just, if I can, take a second to read something, okay? This is an email from, I just want to read 2 pieces of information. This is an email from one of the safety net, one of our Safety Net Alliance hospitals that is, I think this fellow's on the transition team. It says, this is talking about Alan Levine.
You're on the gubernatorial transition.
Yeah.
No, I mean,
Right. Alan Levine made it clear that HMA is going after the money coming back from the feds after the IGTs are matched. In essence, he's saying the safety net should not be getting 115% back. So my point, you all probably remember Alan Levine. Well, now he wants our tax money. He knows about this intimately because he worked here and he worked for ACA, so he understands how IGT money works, and he's trying to get that.
What is IGT money?
Intergovernmental transfers are a way for us to create an enhanced Medicaid rate.
Okay.
Furthermore, and I don't mean it furthermore disrespect, additionally, the FMAT money, the federal matching money, goes away July 1. That impact on our LIP money, we just received this from the Safety Net Alliance, could be $11 million a year. So part of the answer to your question is that these monies could be going away irrespective of anything that we do. So we need to be in a position to continue to take care of the uninsured patient as our mission. And my hope and my plan is that we can do it, and to rebuild a facility like North Broward Medical Center, which will create jobs in the community, is to do it without debt and without taxing the community. That would be my plan. Now, it's a lofty plan, I know that. And there's a lot of calculations that will go into making that lofty plan work. But that's my plan, to continue to do these things without taxing the community. I mean, it's been a bother to me that, that we have to do that. So, I don't have an answer for your question, but I don't directly, but I don't want the question to make it sound like if we transition, something's going to go away, or if we don't, things are changing anyway. They're going to change. And so we have to be positioned to address those changes.
Yes, we all know that, and we know they're coming faster than we can have expected them to come, and they will be coming faster. Legislatively, I cannot say at this time what this whole issue will be and what it will look like if there's legislative discussion about it. Okay. You said that 15540 allows you to do certain things as this moves along. I do not know what the legislature or what the delegation will be looking at as it relates to 15540 and the Broward Hospital District. But I will say that I am concerned about something else that's going on, and that is the loss of the dollars from primary care that Shirley has, found herself in with a $200,000 deficit. And I think that we really need to be a focus at this moment, because that is something that's present, that's happening right now. And those services are desperately needed in the community. So I think that we all together need to be working on the county commission, because that's where those dollars come from. We know that we have some new commissioners who were just sworn in. I don't know if they understand the depth of what has happened with that whole budgetary item. And I would hope that we would be contacting the county commissioners and asking them to look again at possibly finding some dollars from somewhere, because those clinics serve the most needy in our communities. Those clinics are the only, for some people, their only source of medical services. So I think that's something that we need to be looking at.
Representative, just let me assure you, we feel your pain, and Frank and I, before the budget was closed with the county commission, visited with every single one of the county commissioners, other than one who said they were not interested in meeting with us. And we explained to them, what we contract for, what they statutorily must provide to the community, and how important it was, and how they'd cut us the previous years. And they all told us, oh, we hear you, we hear you, we hear you. And apparently they didn't. But we will, you're absolutely right about going to visit with some of the new ones now, and that's a very good point, well taken. Frank and I will make sure we do that right after the
It's
first
the second year that we've been cut, and last year we just absorbed the cuts. Right now we're looking at, some expense reductions. I don't think that's an unreasonable. There may be some expense opportunities anyway. I think we got it a couple of years ago. We got into 340B pricing on, drugs, things like that. But you're right. It's they just pass that on to us, and we have to. And that's that's part of the point on a much smaller scale. Money is going away, and we need a way to replace it. And we need the same ability and the same way to replace it that everybody else has, is my view. Now, again, I don't know whether this will ever work or not, but bottom line is, I think it's worth exploring from a practical community standpoint, because we are the only ones that step up for these programs. Our other competitors, you can see that they provide 20% of the care. So,
Joseph Wells, 789 Northwest 15th Place in the great city of Pompano. Can we just hear from the commissioners? How do you feel about this 501c3? If that's possible, can you tell us it's a good thing, it's a bad thing? What do you feel?
I'm very interested in, primarily, how are we going to care for people who don't have insurance, and then how does the system transfer for people who will be eligible for insurance, and how do they get it, and how do we maintain a system of care that provides quality care for everyone. So the mechanism by which we do that is important, and I have to agree with Representative that the portion that's related to taxes, we have to maintain the sunshine with that. That's critically important. I'm a longtime sunshine advocate, so I don't know how we do that and take that piece away. So those are my personal opinions.
Commissioner Paulus?
I have a couple of comments or questions to ask before I give my views on this. But Jim, I've got a question for you. Have you discerned yet how many of the 23 hospitals that transitioned, if any of them had collected ad valorem taxes? Have we answered that question yet?
Well, we're still tracking it down, but it looks like about half.
Half of the ones that transitioned were, okay. And so you'll give us a formal response when you get it. And then Frank, the consultant, the scope of work, when are we going to get the scope?
well, I have a couple of scopes, and I'm probably going to be another month before we get to that.
Are we going to have that by December?
I think we could, yeah. I want to set up something where some of you meet, you know, like like a workshop or an educational session to hear, because there's a lot of different points of view in terms of how this should be approached, so I think we should pick one.
Okay. And then a comment on Representative Park Reed's question as to criteria for being a board member of the NewCo 501c3. This 15540 allow us to establish criteria we don't select those, we have to be very clear, we don't select as a board those new board members as this transition goes along. They select themselves essentially and come to us.
That's right.
So there's no criteria put forth on our behalf or those people, right?
What could happen is that under the IRS rules, the new not-for-profit entity would develop its own articles and bylaws. They could include within those articles and bylaws criteria for their own selection. But you're absolutely right. This board cannot mandate criteria that they include. Ultimately, though, you'll pass on the articles. So if you see things in there that you don't like, let's say that every board member has to be a multimillionaire. Well, you could say, well, I don't like that, so we're not going to approve it. So you've got sort of a veto, but you don't get to articulate the standards.
Okay.
Madam Chair, just for the record, we discussed on the record the issue of designer documents for having the ability to design, although it's not actually being able to write them, you get to decide on the premise of what's in them, and that's I think what Jim is trying to suggest. That's never been kept from the public. That's an option which you do have to deny. Yeah, sorry about that. To actually deny the articles in the context of a rejection, it's a designer type event where if they're not designed to be compatible with your ultimate thinking, the board has a right to reject them legally and can reject them legally without violating any rules or regulations. And to the extent that you have that overall comprehensive ability, you're not waiving anything in that context. You have that right retained by the board, this board.
Is that an arbitrary decision on our part to engage or not engage with anybody that comes forth?
Well, if I may, and then Jim, please fill in, but to the extent that the statute contemplates public hearings on the lease, on the articles, as well as on the indigent care contract, there are three operative documents this board has the obligation to review publicly and approve publicly. So from the standpoint of setting forth your overall consensus-based direction, the answer is that you will on the record set forth what you expect, what your expectations are, whether they're being met by the documents that you're being given to review. And how that's actually handled will help you making the ultimate decision whether to go with A, B, C, or maybe just with A.
Okay. So now I'll get to my perspective on this process. First of all, I think it's our responsibility, it's our duty to you and to this entire community to study this as an option for possibly finding a way to better manage and oversee the system. My personal belief in, since having become a board member earlier this year, is that the framework for putting us in, putting political appointees in this position overseeing such a complex system probably doesn't provide the best benefit to the community. So I think this is absolutely worthy of exploring on your behalf. I think it's our responsibility to you to look into this very diligently. Now, that being said, we have to leave no rock unturned in the process, because as in any big project like this, there can be very significant unintended consequences that we all have to deal with from decisions that we make. So we're going to study this very, very diligently on your behalf with the interest of ultimately providing you better health care down the road and putting a system in place that allows better health care to be provided to you. So I think this is absolutely worthy of exploring, and it's our responsibility, in fact, to you to do so.
Well, we are here at the Broward Health Forum, and I'm standing with Rhonda Calhoun, the chair. Tell me a little bit about what went on today.
Well, have been coming out into the community. This is our 5th community forum. We're looking at some different strategic models for the North Broward Hospital District, maybe a different way of running things, not with our patients and not with our uninsured, but just a different way of running our everyday business. And we're now looking at a nonprofit, a model for strategic planning.
And what was the reasoning for looking into this in the first place?
Well, when the healthcare reform was being discussed over a year ago, I mean, there was serious conversation at that point in time about our collection of tax dollars that we collect for the uninsured and the possibility of, by 2014, everyone being covered by health insurance. How could we, as the North Broward Hospital District, justify the collection of taxes at that point? Losing the $170 million would certainly put a big dent in our pocketbook. So it was, maybe we need to proactively take a look at another way of doing our business and still providing the health care services to those that we need to serve.
Now, how is this going to affect those that are uninsured?
Absolutely not at all. A nonprofit would still be obligated to serve anyone who walks in their doors.
Okay, what about Medicare? Does that affect that?
No, not at all. Anyone that comes in. What it does affect with Medicare and Medicaid is our reimbursement. Healthcare reform does. They are looking to take back some of those dollars that we now receive for our Medicare and our Medicaid patients and putting it and funneling it into either health insurance proposals that would provide insurance for those that are not insured. So we are looking at the possibility of losing those dollars within our system.
So this is more an internal thing right now.
Oh, absolutely. I mean, we're not closing any of our hospitals. We're not changing any of our infrastructure in any way, nor the services that we provide. It really is, as you said, it's an internal, different way of doing business.
But you are accepting public input for this.
Oh, absolutely. As I said, this is the 5th time we've been out. We want to make sure, when we first brought the idea forward, because we're under the sunshine, the idea had to come forward in a public meeting with everybody at the table. And unfortunately, or fortunately, there was a lot of, we didn't know anything about this. So this is our way of making sure that we get out to everybody and listen to their concerns. We've had some nice different ideas that people have come up with too. Have you looked at this? I think I learned something tonight from Representative Gwendolyn Clark-Reed. So I think it's helpful on both sides.
So when is the next meeting?
We will be meeting again with the community next Monday, November 29th, from 7 p.m. to 9 p.m. at J.C. Carter Park on Sunrise.
Okay, great. Thank you.
Thank you
Rhonda.
very much.